The annual Richardson family reunion was in full swing at the country club, the same venue where I'd endured 32 years of subtle put-downs and not-so-subtle career criticisms. The crystal chandeliers cast their familiar glow over the mahogany tables, where my relatives displayed their success like peacocks preening their feathers. I adjusted my simple black dress, feeling the weight of their judgment as I navigated through conversations about stock portfolios and European vacations. My mother, Patricia Richardson, held court at the center table, her diamond tennis bracelet catching the light as she gestured dramatically. "Sarah's still working at that little clinic downtown," she announced to anyone within earshot. "We keep telling her to find something more substantial. Nursing is fine for some people, but it's not exactly what we had in mind when we paid for her education." My father, Dr. Robert Richardson, a retired orthopedic surgeon who never missed an opportunity to remind everyone of his former glory, nodded sagely. "The girl has potential, but she lacks ambition. Could have been a real doctor like her old man, but settled for taking orders and changing bedpans." I sipped my sparkling water quietly, watching my cousin Marcus regale the table with stories about his latest real estate acquisition. My brother David, a pharmaceutical sales representative, jumped in with his own tales of closing major deals with hospital systems. The irony wasn't lost on me, though they had no idea just how ironic it truly was. "Sarah, dear," my Aunt Linda interrupted, her voice dripping with false concern, "are you still working those terrible night shifts? I read that nurses are burning out everywhere. Maybe it's time to consider a career change? I know someone in medical device sales, much better money, regular hours." "I appreciate the concern, Aunt Linda," I replied evenly, "but I'm quite happy where I am." My mother scoffed audibly. "Happy doesn't pay the bills, sweetheart. You're 32 years old, living in that tiny apartment, driving that old Honda. When are you going to take life seriously?" Before I could respond, my father leaned forward, his voice taking on the condescending tone I'd grown to despise. "You know what your problem is, Sarah? You're comfortable being average. Nursing is a fine profession for people without higher aspirations, but you had the grades for medical school. You chose the easy path." "Robert's right," my mother added, warming to the theme. "You're just a nurse, not a real doctor. There's a hierarchy in medicine, dear, and you're at the bottom of it. Taking orders, following protocols, that's not leadership." The conversation continued around me, each family member adding their own commentary on my perceived failures. My cousin Jennifer, married to a successful cardiologist, shared her husband's thoughts on the nursing shortage crisis. My uncle Frank, who owned a chain of urgent care clinics, pontificated about the importance of real medical professionals versus support staff. Through it all, I maintained my composure, occasionally nodding or offering polite responses. They had no idea that the little clinic I worked at was actually a strategic position I'd taken to stay connected to frontline patient care while managing my other responsibilities. They didn't know that my terrible night shifts were cover for board meetings and acquisition negotiations that happened after business hours. My phone buzzed with a text from my chief financial officer. "Riverside Medical merger finalized. $1.2 billion acquisition complete. Board meeting moved to Tuesday." I glanced at the message briefly before returning my attention to my family's ongoing critique of my life choices. "The thing is," my father continued, clearly enjoying his audience, "Sarah could have been something special. But she chose the path of least resistance. Now she's stuck in a dead-end job, living paycheck to paycheck, while her colleagues, the real doctors, make the important decisions." My mother nodded emphatically. "We've tried to help her see reason. Even offered to pay for PA school. Physician assistant would at least be a step up from bedside nursing. But she's stubborn. Comfortable with mediocrity." The conversation was interrupted by my father suddenly clutching his chest, his face contorting with pain. The color drained from his features as he gasped, his hand reaching desperately for his throat. "Can't breathe," he managed to whisper before slumping forward in his chair. The country club erupted in chaos as family members screamed and reached for their phones. "Call 911, my mother shrieked, her perfectly composed demeanor cracking as she knelt beside her husband. "Someone help him." I was already moving, my training taking over as I assessed his condition. "David, call for an ambulance and tell them we're bringing a cardiac patient to Metropolitan General," I instructed calmly, checking my father's pulse and breathing. Jennifer, clear this space and get everyone back. Mom, I need you to stay calm. What do you know about heart attacks? My mother snapped through her tears. You're just a nurse. We need a real doctor. The paramedics arrived within minutes, and I gave them a precise report of my father's condition, symptoms, and timeline. As they prepared to transport him, one of the EMTs asked, "Which hospital?" "Metropolitan General," I replied automatically. "They have the best cardiac unit in the city." The ambulance ride was a blur of medical equipment and my mother's panicked sobbing. She kept insisting that we needed to find a real doctor once we reached the hospital, someone who could actually help rather than rely on nurses and support staff. We arrived at Metropolitan General's emergency department, and I watched with practiced eyes as the trauma team took over. The organized chaos of a level 1 trauma center during a cardiac emergency was something I'd witnessed thousands of times, though never with my own father as the patient. "Where's the doctor?" my mother demanded of the triage nurse. "We need the best cardiologist you have. This is Dr. Robert Richardson, he's a physician himself. He needs immediate attention from your top people." The nurse, a young woman I recognized from my monthly department meetings, looked confused as she glanced between my mother and me. The cardiac team is already on their way." Dr. Sarah Richardson was paged as soon as the ambulance called in the MI alert. My mother's face went blank. "Dr. Sarah Richardson? But that's my daughter. She's not a doctor, she's just a nurse." The code blue alarm began blaring throughout the emergency department as my father went into cardiac arrest. Without hesitation, I pushed through the trauma bay doors, grabbing a gown and gloves as the crash cart arrived. The familiar weight of leadership settled on my shoulders as I took my position at the head of the bed. "What's the rhythm?" I called out, my voice cutting through the chaos. "V-fib," the resident replied, holding up the EKG strip. "Charging to 200 joules, I announced, taking the defibrillator paddles from the crash cart. The room cleared as per protocol. "Everyone clear." The shock delivered, I watched the monitor as my father's heart rhythm converted to a more stable pattern. "That's better. Let's get him to the cath lab stat. Page Dr. Martinez and tell him we have an emergent STEMI." As the team prepared to move my father to the cardiac catheterization laboratory, Dr. Amanda Chen, my chief of cardiology, approached with a tablet full of his charts and test results. "Dr. Richardson," she said formally, though I could see the slight smile in her eyes, "your father is responding well to initial treatment. The EKG shows a massive anterior wall MI, but we caught it early. I'll handle the catheterization personally." My mother, who had been standing frozen in the doorway, finally found her voice. "Dr. Richardson? But, Sarah, what's happening? Why are they calling you doctor? You're a nurse." Dr. Chen looked genuinely confused. Dr. Sarah Richardson is our chief of cardiothoracic surgery and CEO of Metropolitan General Hospital. She's also the founder and majority owner of the Richardson Healthcare Network, which includes 12 hospitals across the state. The silence that followed was deafening. My mother's face cycled through confusion, disbelief, and dawning realization as the words sank in. Behind her, family members who had followed the ambulance were arriving in the emergency department, their own faces reflecting similar shock. "That's impossible," my mother whispered. "She works at a clinic downtown. She's just a nurse. She lives in a tiny apartment and drives an old car." "Mom," I said gently, pulling off my gloves as the cardiac team wheeled my father toward the elevator, "we need to talk. But first, let's get Dad taken care of. He's in excellent hands with Dr. Chen." As we moved to the family waiting area, the truth began to unfold. The little clinic downtown was actually the Richardson Free Clinic, a facility I'd established 5 years earlier to provide health care to underserved populations. I worked there 1 day a week, not because I had to, but because it kept me connected to the direct patient care that had originally drawn me to medicine. The tiny apartment was actually the penthouse level of a building I owned downtown, kept deliberately modest in its furnishings to maintain the facade I'd carefully constructed. The old Honda was one of several vehicles I owned, chosen specifically because it was reliable, practical, and wouldn't draw attention from my family. "But why?" my mother asked, her voice barely above a whisper. "Why didn't you tell us?" I considered my answer carefully as we settled into the private family consultation room that the staff had prepared for us. Through the windows, I could see the cardiac catheterization lab where my father was receiving treatment, state-of-the-art care provided by the team I'd personally recruited and the equipment I'd personally funded. Because every time I tried to share anything about my work, you dismissed it, I replied quietly. Every achievement was minimized, every goal was criticized as not ambitious enough. You decided I was a failure before you ever bothered to learn what I was actually doing with my life. My brother David, who had arrived with his wife, stared at me in amazement. But Sarah, you never said anything about owning hospitals. You let us think you were just ordinary. I am ordinary, David. I'm a doctor who happens to own some hospitals. That's not what defines me. I paused, looking around at their stunned faces. What defines me is that I've built something meaningful. The Richardson Healthcare Network employs over 15,000 people and serves 500,000 patients annually. We've pioneered new cardiac procedures, funded medical research, and provided millions of dollars in charitable care. The family sat in stunned silence as the full scope of my accomplishments became clear. The years of condescending comments, career advice, and thinly veiled disappointment suddenly seemed absurd in the context of what I'd actually achieved. My mother's phone began ringing insistently. The caller ID showed my Aunt Linda's number. She probably heard about Dad, Mom said, answering the call. Hello, Linda. Yes, Robert had a heart attack. We're at Metropolitan General. What do you mean you saw it on the news? I could hear my aunt's excited voice through the phone speaker. Patricia, do you know who owns Metropolitan General? It's your daughter. It's all over the business news. Sarah Richardson, founder of Richardson Healthcare Network. They're calling her one of the most successful healthcare entrepreneurs in the country. The conversation that followed was surreal, as family members began calling and texting, each one having discovered through various news sources and social media that the family member they'd spent years dismissing as underachieving was actually a multimillionaire healthcare mogul. Dr. Chen returned with an update on my father's condition. The catheterization went perfectly, she reported. We placed 2 stents, and blood flow has been completely restored. He should make a full recovery with proper cardiac rehabilitation. As my family absorbed this good news, Dr. Chen addressed me directly. Dr. Richardson, the cardiac board meeting has been moved to tomorrow morning to accommodate tonight's emergency. Also, the mayor's office called. They'd like to discuss the proposed children's hospital project next week. After Dr. Chen left, my mother looked at me with tears in her eyes. Sarah, I owe you an apology. We all do. We were wrong about everything. You weren't wrong about me being a nurse, Mom. I am a nurse. I'm also a doctor, a surgeon, and a business owner. But at my core, I'm still the person who chose healthcare because I wanted to help people. That hasn't changed. Over the next few hours, as my father stabilized in the cardiac intensive care unit, my family began to process the full reality of who I actually was. The penthouse apartment tour would come later, along with visits to the Richardson Healthcare Network headquarters and the medical school I'd endowed at the State University. But what mattered most was watching my father recover in one of the cardiac beds I'd personally helped fund, receiving care from the team I'd assembled, in the hospital I'd built from the ground up. As I checked his monitors and reviewed his chart, I realized that all the years of hiding my success had been worth it for this moment, not because they finally understood my achievements, but because when it mattered most, I'd been able to save my father's life. The next morning, as Dad was transferred to a regular room and pronounced on track for a full recovery, my mother approached me in the hallway. Sarah, can you forgive us for being so wrong about you? I smiled, adjusting his foreline with the same hands that had signed billion-dollar acquisition papers the week before. Mom, you weren't wrong about who I am. You were wrong about thinking that wasn't enough. As I walked through the halls of my hospital, greeting staff and checking on patients, I reflected on the strange irony of the situation. My family had spent years telling me I wasn't ambitious enough, wasn't successful enough, wasn't important enough. They never realized that the just a nurse they dismissed had built one of the most successful healthcare networks in the country, one patient at a time. The white coat I wore bore my name, Dr. Sarah Richardson, MD, Chief of Cardiothoracic Surgery. But underneath it all, I was still exactly what I'd always told them I was, a nurse who cared about helping people. Everything else was just the natural result of pursuing that calling with determination and vision. Some family reunions end with awkward goodbyes and promises to stay in touch. This one ended with my relatives finally understanding that sometimes the person you think you know best is actually someone far more extraordinary than you ever imagined.